Trochlear nerve. This is the fourth cranial nerve. Now, fourth cranial nerve. This cranial nerve, everybody knows. I think it's easy that it supplies only one extraocular muscle, and that is superior oblique muscle of the eyeball. Then, functionally, it is categorized into two functional groups: general somatic afferents. This is for the proprioceptive sensations from the muscle it supplies, and general somatic efferent is for the movement or contraction of the muscle it innervates, that is superior oblique. Okay, so first have a look here on the inferior of the aspect of the brain. So here you find that this is the brain stem, this is the midbrain, then pons, and this is the medulla oblongata. So this nerve, trochlear nerve we are talking, is the fourth cranial nerve. This nerve emerges here from the lower midbrain, just lateral to the crus cerebri. Cerebral. These are the cerebral peduncles, and the ventralmost portion of the cerebral peduncle is called the crus cerebri. So this is the peculiar features about the trochlear nerve are, first of all, that it is the only cranial nerve that emerges on the dorsal aspect of the brainstem is one. Then there are some authors who write that trochlear nerve is the nerve which is having the longest intracranial course, although there is a debate, because many authors have even written that abducent is the cranial nerve with the longest intracranial course. So I think, which we have studied since long, that abducent lately, earlier we used to study that trochlear is the cranial nerve with the longest intracranial course. Okay, but now it's fine that abducent, I'll tell you, actually both of them are having a long course, even trochlear and abducent both. But abducent is said to be the nerve with the longest intracranial course. So this trochlear nerve, it winds around the dorsal aspect of the brainstem, winds laterally along the cerebral peduncles and the superior cerebellar peduncle, and emerges here between the upper border of the pons and the temporal lobes. This is the side where you find is trochlear nerve that emerges out. Okay. Now about the functional columns. This trochlear nerve innervates which muscle? Superior oblique muscle of the eyeball, right? So this is a motor function and motor nerve, right? So you're seeing that here it's the midline, right? And in the midline, you're seeing is just lateral to the midline. This is sulcus limitans. Between the midline and sulcus limitans, this is called the basal lamina, and lateral to sulcus limitans, it is the alar lamina. So these are the efferent functional columns, and the medial most is the general somatic efferent. So this includes the nucleus of third and fourth cranial nerve in the midbrain, and nucleus of sixth cranial nerve, and nucleus of 12th cranial nerve, right? These are mainly motor nerves, right? So they're innervating the muscles derived from somites or somatomeres. Trochlear nerve nucleus is found in the lower portion of the midbrain at the level of inferior colliculus. Then I told you there was another functional column, and that was the afferent, general somatic afferent, which was for the carrying proprioceptive impulses from the muscle that it innervates. So that will relay here in the mesencephalic nucleus of the trigeminal nerve. Okay, it's actually this function column. General somatic afferent is completely the nucleus of trigeminal nerve, but most of the nerves, like which cranial nerve which innervates these muscles, skeletal muscles, they also bring the proprioceptive sensations as well as exteroceptive sensations. So the muscles which, the nerves which are bringing proprioceptive sensations will all relay here in the mesencephalic nucleus of the trigeminal nerve. This includes, third, that is oculomotor nerve, then trochlear nerve, then abducent nerve, facial nerve, right? Ninth and 10th and 11th and 12th cranial nerve, right? So here all the cranial nerves which is innervate the skeletal muscles, they bring the proprioceptive sensations to the mesencephalic nucleus of trigeminal nerve, right? And this is the chief sensory nucleus which brings the exteroceptive sensations from the face region, and this is bringing the general exteroceptive sensations from the face. So remember that this portion, the spinal nucleus of trigeminal, this includes fifth nerve as well as the ninth, 10th, and you can include 7 also, because 7 also, the facial nerve also is bringing sensations from the external auditory meatus. So this was about the general somatic afferent column. Okay. Now here you seeing is intraneural course of trochlear nerve. This is a section of midbrain at the level of inferior colliculus, lower portion of the midbrain. Remember, it was this portion which was emerging from the free portion of tentorium cerebelli into the middle, into the supratentorial compartment. So here it was a notch, the free portion of tentorium cerebelli. Then you know it that this portion here, portion that is dorsal to the gray matter or the cerebral aqueduct, this is called tectum. This is tegmentum. This substantia nigra, the anterior portion of here, ventral portion, it is the crus cerebri. And the two halves are the cerebral peduncle. These are called the cerebral peduncles, right? To which the two cerebral hemispheres are attached. Then the nucleus for the trochlear nerve is embedded in the gray matter ventromedially, right? You find the two nucleus for the trochlear nerve. And this trochlear nerve nucleus is ventromedially closely related to the medial longitudinal bundle. Remember, I told you this medial longitudinal bundle was a, like, एक एग्जांपल दिया था मैंने ग्रुप कॉन्फ्रेंसिंग के लिए, chatting, whatever video conferencing, where like four cranial nerves reach here to synchronize and coordinate with each other for the harmonious binocular movements of the eyeball. And there was like third, fourth and sixth and the eighth nerve which intersynapse to bring about smooth binocular movements of the eyeball, right? So this is medial longitudinal bundle placed here, just ventromedial to the nucleus of trochlear nerve nucleus. And because it has a communication with the mesencephalic nucleus, I told you the afferents coming here, general somatic afferents, they will relay here in the mesencephalic. And mesencephalic not only here, but it also ascends up to the upper portion of the midbrain, and just parallel to the mesencephalic is actually related to the oculomotor nuclear complex, remember? So then, yeah, this nerve, when it emerges from its nucleus, it soon winds dorsolaterally on its side, and then when it reaches to the dorsum of the midbrain, Here actually is this portion, you know, this is called frenulum veli. This portion here is called frenulum veli, the point where it emerges on the dorsum, on the two sides of the frenulum veli. This trochlear nerve decussates to emerge on the opposite side. So when it emerges on the opposite side, then it winds around the cerebral as well as superior cerebellar peduncle. Then it emerges down here between the upper border pons, and here it will be the temporal lobe of the brain. There it will emerge. So it will not be a content of interpeduncular fossa is here, and it will not be a it will not be a content of interpeduncular cistern also. What other things you find here? Remember, if you remember a diagram at the level of superior colliculus, right? So there was the, similarly there was oculomotor nucleus here, and the oculomotor nerve was emerging out like this ventrally, right, from the oculomotor sulcus. And in between there were two decussations, right? Dorsal was the, remember, tectospinal decussation, and ventral tegmental decussation was in the upper midbrain. It was the rubrospinal decussation. But these are the differences you have to appreciate and to remember, because they're questions asked to draw in your first year exams, and in your entrance PG entrance exams there are questions being asked on the image based questions. So you have to identify, if there's nothing written, like, you have to identify that section is through which portion of the brainstem. One thing is very clear, because of the nerve that is emerging dorsally. And the other thing is that the two decussations which you find at the upper level, they will now become tract, because they are descending tracts, right? They were extrapyramidal tracts. So tectospinal was forming the dorsal tegmental decussation at the upper level of the midbrain, but here you will find it in the form of tract, tectospinal tract. Similarly, the ventral tegmental decussation at the level of midbrain, it was being formed by the rubrospinal tract. So in the upper portion, you'll find a decussation, but at the lower, in the lower section of the midbrain, you will find is rubrospinal tract, right? Then, because this midbrain, it's through this midbrain, the two cerebral peduncles are attached, the cerebral hemispheres are attached, and these two extend up to attach with the cerebral hemispheres. So these are cerebral hemisphere peduncles. But remember that cerebellum is also attached with the midbrain pons and medulla. It's placed dorsally to the brainstem. So with the help of its three peduncles, superior, middle, and inferior, they are paired peduncles. Superior peduncle, you know, joins this midbrain. So you find is decussation of superior cerebellar peduncles. Remember, at which you'll find is at the lower level of midbrain, at the level of inferior colliculus, right? Okay, we'll we'll study the further details when we'll talk about the brainstem. Right now, we are focusing only on the trochlear now. Okay, then this is a mid-sagittal section seen from the lateral side, and this, is the midbrain with the two superior inferior colliculus. This is the pons. Then you have this medulla, and on the dorsally in the lower half of the pons and upper portion of medulla, you find is a tent-shaped cavity that's called the fourth ventricle. So the floor of the fourth ventricle is formed by the lower portion of the pons and upper portion of the medulla, and this is the cerebral aqueduct, which is the central continuation of the third ventricle, or a communication from third to fourth ventricle. This central aqueduct, which is the cavity of the midbrain. Then this fourth ventricle, you can see, is opening behind there, and this is for foramen of Lashka and Magendai. Okay. There are three foramen in the roof of the fourth ventricle through which it communicates to the cisterna magna, cerebellomedullary cistern, right? Although this fourth ventricle continues as the central canal of spinal cord as well. Okay, so that was about the orientation. Now we are talking about nucleus. Look here, this is the midbrain, and at the level of the inferior colliculus you find this nucleus, the trochlear nerve nucleus, and from there these fibers are emerging out, winding dorsally laterally, and then emerging dorsally, right, at the either side of frenulum veli. And you can see that, remember, in the gray matter there was this nucleus, the mesencephalic nucleus of the trigeminal nerve. So the trochlear nerve also communicates with the mesencephalic nucleus of the trigeminal nerve, and it emerges dorsally. Okay, that was about the nucleus. Now with its communications, right? To perform an action, a nucleus needs to have, impulses coming down from the higher centers, like to perform a definitive or a planned action. So their impulses reaching from the higher centers, because it's a motor nerve, right? So it will act according to the information being sent to the higher centers. And for that, as I told you when I was teaching you about the oculomotor nerve, similarly in case of trochlear and abducent nerve, the communications will all be the same, except because, remember, third nerve nucleus, how third nerve, how is it different from fourth and sixth nerve? Was the reason is that it was having an additional functional column, and that was general visceral efferent, and that was for the intraocular smooth muscles, constrictor pupillae and ciliaris, and that's why it was having another functional column, and the fibers arising from the edingo-vespal nucleus was running in the oculomotor nerve, and this functional component is not included in fourth and sixth nerve, right? So that, the tract, tech from the pretectal nucleus is related to visual stimulus. So pretectal nucleus was sending fibers to both the edingo-vespal nucleus, right and left. So, and that was to control the pupillary reflex, right? So you can say consensual light reflex. Consensual light reflex, I told you, if you know focus the torch in one eye, you will find constriction of pupil in both the eyes, and that's called consensual light reflex. So this function, and that was because of the smooth muscle contraction. So this functional this communication will not be seen in abducent and trochlear nerves. Okay, then remaining communication will still be there. You can see the corticonuclear tract. It's a part of pyramidal tract descending from the higher center. I told you, चाहे वो visual center से communication हो, चाहे वो auditory से हो, you focus your eyes in response to visual stimulus, you rotate your eye in response to auditory impulse, or any psychosomatic psychosomatic reflexes, images from the higher centers. So you move your eyes accordingly, right? Then there is a scanning reflex also. If you are reading a book, right? So if you're reading a book, your eyes are, moving line by line from left to right, right? You may not be moving your head, but your eyes are moving according to the scanning pattern with which you are reading. So that means it's being controlled from the higher centers, right? So This is the purpose of upper motor neurons. Corticonuclear tract, which is part of pyramidal tract, it communicates with them. But remember, the fibers from the higher centers reaching to the three nuclei, oculomotor, trochlear, and abducent, they will all be ipsilateral. Then, obviously, I told you because there are seven muscles. Out of the seven muscles, five by innervated by oculomotor, SO4 LR6, superior oblique and lateral rectus, they are by trochlear and abducent nerve. So, because of the smooth binocular homogeneous movement of the eyeballs, these different cranial nerves will have to synchronize accordingly. Even with a fraction of seconds, they have this ekdam appropriate movement aega. I told you, if you're looking at the right side, so both of your eyes will look towards the right side. So in that case, your right eye, the muscle will be involved, will be the lateral rectus of the right side. And in the left eye, it will be the medial rectus. And both these two muscles are having different nerves. On the right side, it is abducent, and on the medial side, on the left side, it will be oculomotor nerve. So they have been synchronized, right? So for that purpose, I tell you, there was a communication with the three nuclei as well as the auditory nerves in the medial longitudinal bundle. Communication of these nucleus for coordination of the eye movements. Then to tectobulbar tract for visuoprotective reflex, I told you ये tectobulbar is tectospinal as well, और ये decussation कहाँ पे हुआ था? Superior section of the upper level of the midbrain पे हो रहा था. Then you find trochlear in lower section of the midbrain में, you'll find the tract tectobulbar or tectospinal, right? Then इसका पर्पस क्या होता है? तो ब्लिंकिंग रिफ्लेक्स, जैसे मैंने बताया था, इफ somebody claps in just in front of your eyes, you blink your eyes, right? If somebody throws a paper ball, you blink your eyes. Or might be somebody throws a ball, so you will place you bring your hand in front of your eyes. So until you're not using the limbs, you only reflect, you're blinking your eyes. That is the visuoprotective reflex, and that's being controlled by tectobulbar tract. And if you have to move the limbs to protect your eyes, you're bringing your hand in front of your eyes when somebody throws a ball at your face. That means it's now the tectospinal tract, right? Because the fibers will reach down to the spiral segments of the spine, right? So that's why tectospinal tract. These are for the discommunication for visuoprotective reflex. Then I told you, because of these muscles, they're skeletal muscles, so it will have proprioceptive impulses from these muscles. There will be relay in the mesencephalic nucleus for the proprioceptive sensations from extraocular muscles. Got it? So remember, these are the four communications of the trochlear nerve. Now you were seeing, we have moved out from the intracranial. Earlier what we were studying was within the CNS. Now after that CNS course, the intracranial neural course, it will now emerge out. How will these emerge out? Remember, look, this is the midbrain, this is the pons, medulla, and the fourth ventricle. This is the central aqueduct, and this is the central canal of spinal cord. So this I'll go. This is the lateral dorsal recess. Actually, this is small recesses of the fourth ventricle. Look here, this roof of the fourth ventricle, right? So roof the fourth ventricle. This is inferior colliculus, and this is superior medullary velum, and this is inferior medullary velum, and this is the pia going inside, and this will form the tila choroidea in the roof of the fourth ventricle. So at this level of superior medullary velum, if you see the dorsal aspect, there was frenulum vela, from where this trochlear nerve is emerging on the dorsal aspect, right? Look here, now this is the dorsal aspect of the brain stem, right? So this is the level of the midbrain, then you have the pons, then the medulla. And you see that these are the cerebral peduncles to which it is communicating to the cerebral hemispheres. This is the roof of the third ventricle, the diencephalon, onto which you find is pituitary gland, or pineal gland, situated on the roof of the diencephalon, or the third ventricle. This is the midbrain. On the dorsal aspect, you find superior colliculus and inferior colliculus. Both are continuous with the superior and inferior brachium, literally. Then this, portion of the midbrain, laterally and ventrolaterally, this portion is called the crus cerebri, right? Crus cerebri, and together you call it as cerebral peduncles. So this is crus cerebri seen ventrally. Then, cerebellum is covering this opening. This is an opening, a diamond-shaped fossa in the lower pons and upper medulla. This is called the fourth ventricle. And this all is covered by cerebellum. So cerebellum now will attach to midbrain via this superior cerebellar peduncles. Superior cerebellar peduncles, and this is the middle cerebral peduncle through which it communicates to the pons, and this is the inferior cerebellar peduncle through which it communicates with the medulla, right? Now you see that just below to the you know inferior colliculus, okay, you find this portion called frenulum veli. So on either side of frenulum veli, you find this trochlear. Now, although they have made in red, which is a bit confusing, it seems to be an artery, but at least they have written it here that it is trochlear nerve. So presume that it's trochlear nerve, which emerges from the lateral side of frenulum veli on the dorsal aspect. But remember, they have already decussate, right? So this one is coming from this side, and this one is coming from this side. So they decussate and then they move around. And can you see now, when after on the dorsal aspect, when they decussate and they wind around the two structures, remember, they wind around the superior cerebellar peduncles and then the crus cerebri. You can also say it to be cerebral peduncle, because together with the crus cerebri, substantia nigra, and tegmentum, you call it as cerebral peduncles. So it winds around these two structures, superior cerebellar peduncles and crus and cerebral peduncles, or crus cerebri. Then it emerges on the ventral side, and when it reaches the ventral side, it will be found in at the level of upper body of the pons, and laterally it will be temporal lobes. Now you'll find is this view. So this you're seeing is the basi occiput, and on the surface on inside is called clivus, which reaches here to form, to the apex of petrous temporal bone. It's a sagittal section, got it? And then it reaches here. This is the brainstem, pons, midbrain, and the medulla. Can you see now the inferior colliculus below to that? This nerve is winding laterally and coming forward. So from there, it's already decussated, coming from the opposite nucleus, winding superior cerebral peduncle, winding the crus cerebri or the cerebral peduncle. Then when it reaches the ventral aspect, remember, it was passing in between the two vessels, just like the oculomotor nerve. It will pass in between posterior cerebral artery above and superior cerebellar artery below. चिमटे की तरह से दोनों clasped हैं between the two vessels. Then after that, it crosses this subarachnoid space. Then it further moves in front, and it will perforate the roof of the cavernous sinus, and this is just the posterolateral corner of the roof of the cavernous sinus, with where it will perforate and will run and will reach into the sinus, and it will run along the lateral wall of the cavernous sinus. Okay, so here you seeing its intracavernous course of the fourth cranial nerve. This is the two splitted layers of dura mater. This is the endosteal layer, this is the meningeal layer, and this is the diaphragma cellae, which is, this hypophysis cerebri with the pituitary gland. This is the infundibulum, or the hypophysis cerebri, same as pituitary. So it lodges this portion is called the sella turcica. So within the sinus, there is an endothelial layer which encloses the venous blood, and you have a siphon-like course of internal carotid artery in within this. Right, this is an entry point, and this is the exit point of internal carotid. So in the lay, and this is related infralaterally to the abducent nerve on the medial side of the cavernous sinus. Laterally, you have four nerves. The uppermost is oculomotor nerve, then you have trochlear nerve, and then you have V1 and V2 nerves. So this trochlear nerve, remember, within the cavernous sinus, it is running below the oculomotor nerve along the lateral wall, but in the anterior portion of this cavernous sinus, remember, oculomotor nerve, I've told you that, and the anterior portion of the cavernous sinus, oculomotor nerve divides into its upper and lower divisions, right? And the two divisions later on emerges, and they enter the superior or middle portion of the supraorbital fissure. But trochlear nerve, actually, remember, क्योंकि trochlear nerve LFT याद आया, superior orbital fissure में upper and lateral portion of the supraorbital fissure, so it has to pass through trochlear nerve. So that means it will cross above to the oculomotor nerve, and that is happening within the cavernous sinus. So trochlear nerve within the anterior portion of the cavernous sinus will cross the oculomotor nerve to run above this nerve to reach the upper lateral portion of the supraorbital fissure. Now you see this is the apex of the orbit when see from the front view. This is the supraorbital fissure, this is the optic canal, and this is the common tendinous ring, tendon of Zinn कहते हैं. Then the four recti are attached to it: superior rectus, inferior rectus, medial rectus, lateral rectus. Through the optic canal, what is passing? Optic nerve, and this is the ophthalmic artery. Then this upper portion, you can see, you look here, the middle portion, there were two divisions of oculomotor nerve, and in between the two was the nasociliary, and infralaterally was abducent. But in the upper portion, LFT, remember, lacrimal, frontal, and trochlear. So trochlear nerve is emerging from the supralateral portion of supraorbital fissure into the eye, into the orbits. So this, you can see, is the entry of trochlear nerve within the orbit. Then the four recti you have seen, then these are the superior levator palpebrae superioris above to the superior rectus, and supromedially is the origin of superior oblique muscle, and this muscle has an anterior origin, like, and this one is inferior oblique, which forms a sling below the eyeball. The purpose of telling here is the course of trochlear nerve. Remember, trochlear nerve will cross, wind dorsal, wind medially, and run above the two muscles like LPS and superior trochlear, and will reach to supply or innervate the orbital surface of superior oblique muscle. ये मैंने पिछले लेक्चर में ही पढ़ा दिया था that all the 7 extraocular muscles are innervated on their orbital surface except abducent nerve which innervates the medial surface of lateral rectus or the ocular surface, and the nerve to inferior oblique innervates on its posterior border. Okay, this you have done. Now look the orientation, the fibers of superior oblique muscle, because to understand the action you need to know how this muscle runs within the orbit. Just now I told you that at the apex there was a common tendinous ring, and although the oblique muscle, the four recti which take origin from the common tendinous ring. So if they're showing you superior rectus, that means they have removed LPS. So LPS has been dissected out, because otherwise LPS would have covered this muscle from above, because it was the dorsal most muscle. Then, supromedially, away from the tendinous ring, from the body of sphenoid, this muscle that was arising is superior oblique muscle. This muscle runs along the medial wall of the orbit. Then it reaches and winds through this trochlea. It is a pulley at the little crest of the lacrimal fossa. It's a fibrocartilaginous pulley. And passing through this, the interbelly tendon. I told you this was a muscle having an interbelly tendon. Then the rest of the belly, it passes backwards laterally, and it crosses the equator of the eyeball. And it runs below superior rectus, and it is attached here, inserted here on the posterior hemisphere of the eyeball in the suprolateral quadrant between superior rectus and lateral rectus. Clear? Although in the same diagram I'll show you is although a little faintly shown, because that muscle is running below the eyeball, is this muscle. Can you appreciate this? This muscle. And this is the only muscle I told you is taking anterior origin. This muscle takes origin from the anterior margin of the orbit along the medial wall, just infromedially. This muscle arises and it runs below the eyeball, below the inferior rectus, right? And it winds around. That's why it was forming a sling onto which this eyeball is resting. It winds this along the inferior border of the inferior surface of the eyeball, passing below the inferior rectus, and then it passes below the lateral rectus and inserts opposite to the insertion of superior oblique. This is the insertion of inferior oblique. So inferior oblique कहाँ पे insert हो रही है? Again, this also crosses the equatorial plane of the eyeball, and it inserts on the posterior-inferior quadrant on the posterior hemisphere of the eyeball, right? Just opposite to the insertion of superior oblique. Leave everything like what is the actual action. Think about the actions of different other muscles. Think about the action of superior oblique. So if this muscle will contract, what will happen? It will have a pull in this direction. So with the pull of this muscle, this will pull the eyeball in this direction. So what will happen actually, first thing is eyeball will dip down. It will dip down and it will be adducted and medially rotated. So, the exact position, if you have to check that what is the ruling out the action of the rest of the muscles, superior oblique actually, when you're testing this muscle, the eyes will be pointing towards the tip of the nose. That is the exact action of superior oblique when tested alone. Okay. Then you are seeing is the course and summary of this trochlear nerve. As just fast revision, this arises from the midbrain at the level of inferior. You can correct it in your book that it arises from the inferior colliculus at the level of inferior colliculus of the midbrain. The nerve, decussates. Then at the level of superior medullary velum, there is this frenulum veli, from where it decussates and emerges out and then winds around the this superior cerebral peduncle and cerebral peduncle. And when it reaches here, it reaches the upper body of the pons, and later you'll find is the temporal lobe of the cerebral hemisphere lateral to this nerve. Then this nerve will cross the subarachnoid space and will now pass through in between the two arteries, posterior cerebral artery above here, and then you have superior cerebral artery below. And then this nerve reaches this basis sphenoid ka joint inner surface, and that is called clivus, the upper portion of clivus. And this is the roof of the cavernous sinus. You can say posterolateral corner of the they've not actually shown it very well. It is not like this cavernous sinus is only restricted to this much region. So it perforates the roof of the cavernous sinus, posterolateral corner, runs along the lateral wall of cavernous sinus. In the anterior part, it crosses above the oculomotor nerve and will reach the orbit through the supralateral portion of the orbit through the supraorbital fissure, and within the orbit it will pass above to these superior rectus and the other LPS, and will wind lateral medially and will supply superior oblique muscle on its orbital surface. Okay. Now think what happens if this nerve is injured. So if this nerve will injured, obviously you think about what actually it does. It superior oblique का थोड़ा सा complicated सा action है because of its difference in being a muscle with two bellies and having a different type of insertion. So जो मैंने बताया था alone action of the muscle, वो याद रखना है टेस्टिंग के लिए. And if it's paralyzed, and remember when I taught you the oculomotor nerve, I told you the muscles involved, the combined action, muscles involved in moving the eyes in different direction. So normally, if it's asked what is the action of superior oblique muscle? So superior oblique muscle actually, it dips the eyes and abducts the eyes infrolaterally, right? That is the action of superior oblique muscle. So if it is paralyzed, right, because of the injury to the nerve, now what will happen if a person is looking above the horizontal plane? Like if the person is looking above the horizontal plane, you find that his eyes are working fine. You will not find as any sign if a person sitting in front of you, your eyes will be focusing fine. But if it looks down, so in a downward gaze, because now you will find that because of the weakness of superior oblique, the other muscles will dominate, right? So in this case, when a person with superior oblique oblique muscle paralysis, it gets adduct, it gets slightly, normally, it gets elevated, right? Instead of dipping down, it is slightly elevated. ये कंपैरिजन हम देखेंगे दोनों आईज में. तो जिस साइड सुपीरियर ऑब्लिक मसल की पैरालिसिस है, आस्क हिम टू लुक डाउन, यू विल फाइंड द नॉर्मल आई dipping down, but the in an affected eye, he will not be able to dip down his pupil. No, diplopia of course will occur because of the double vision. Diplopia occurs on looking downwards. Vision is normal so long the eyes look above the horizontal plane. क्योंकि हॉरिजॉन्टल प्लेन के ऊपर जितना भी हम देख रहे हैं, there is no role of superior oblique. You have seen, like, the insertion of superior oblique. It passes above the eyeball and attaches posteriorly. So when it will contract, it will dip down the eyeball. यानी कि जो pupil है, that will be turned downwards. So it has no role in upper movement of the eyeball. So when you're looking above, there is no diplopia, and no, apparently there's no squint sitting in. Somebody sees in front, sees you from the front. So there is a defective depression of the adducted eye. The affected eye drifts upwards relative to normal eye due to unopposed action of the remaining. अब तुम्हें चेक करना है इसको. चेक करने के लिए अब उससे क्या करेंगे, हम उससे ये कहेंगे कि अपने टिप ऑफ द नोज को देखो दोनों आंखों से. और टिप ऑफ द नोज को अगर देखेगा तो उसकी जो अफेक्टेड आई है वो डिप नहीं करेगी, पॉइंट नहीं करेगी टुवर्ड्स द टिप ऑफ द नोज. दैट मींस डाउनवर्ड्स एंड एडक्टेड आई में कंट्रीब्यूट नहीं करेगी, रादर इट विल बी ड्रिफ्टेड अप because of the action of superior rectus, inferior oblique. Got it? So individual action of superior oblique muscle is to rotate the eye towards the tip of the nose. ये चेक करने के लिए होता है, और ये नहीं परफॉर्म कर पाएगा तो जिस साइड पैरालिसिस होगी उस साइड नीचे और मीडियल देखने पे जो अफेक्टेड आई है वो ऊपर की तरफ छुट जाएगी. ठीक है, स्क्यू मूवमेंट हो जाएगा. Okay, so we are done with this trochlear now.